It is important for horse owners to know how to take a respiratory rate because the respiratory rate is one of the basic parameters for taking vitals in horses. It is also an indication of how severe disease could be and whether or not it's an emergency. So when you take your horse's respiratory rate, stand slant behind the horse and carefully watch the area where the horse's flank moves in and out. You count that movement over a 60-second period of time. You do that because the horse's respiratory rate typically is very slow. So if you count it in less time, you will get an inaccurate reading. You can also take your horse's respiratory rate using a stethoscope, and the best places to listen are going to be right over the trachea, so on the middle of the neck, on the midline. You can listen and hear very nice airway sounds in pretty much all horses. In horses that are fat, it's going to be very difficult to hear airway sounds at rest over the thorax, but you can try. And certainly in thinner horses, you can try on the dorsal half and on the ventral half of the lung field, and then again count over a 60-second period of time. So the normal respiratory rates for horses at rest should be about 8 to 16 breaths per minute. In foals, the respiratory rate should be around 20 to 40 respiratories per minute, and some of that depends on the age of the foal. The best place to take your horse's respiratory rate is in the stall where it's comfortable, ideally during a time where he's completely relaxed, maybe after you've groomed the horse or a few hours after it's been eating. The idea is that he's quiet and you can make that count in a relaxed environment. Some of the things that can affect your respiratory rate reading are whether he's eating, whether he's sniffing, just came back from exercise. All those things will lead to an elevated respiratory rate that is not the true resting respiratory rate. If you have any concerns about your horse's respiratory pattern or rate, please call your equine veterinarian to have your horse evaluated.